A few weeks ago, someone asked in one of the Facebook podiatry groups that I follow, they asked a simple question. Do you need to do a biomechanical exam to get a diagnosis of a patient's condition? Now, there was a lot of different answers to that. What do they mean by a biomechanical exam? There are so many different ways of assessing a patient's foot condition and its dysfunction, and then creating a treatment strategy to address it. It's unlimited almost. So what do you mean when you say, well, you need an exam of what? Added to this, there's different treatment approaches that different clinics have. Are they treating the immediate symptomatic concern, or are they offering a more holistic service that looks at the underlying cause as well? Now, both approaches are reasonable in the appropriate circumstance. And then you've got different practitioners focusing on different areas. It might be looking at joint angles or manipulation or soft tissue work or orthotics. But why do we do an examination in the first place? And do all patients need the exact same examination techniques? What is our aim when we gain that information, and how confident can we be in the outcome? The full examination of the foot and its function has been designed to address these questions. It provides a pathway to focus on the patient, how to engage them from the start so they take on the responsibility of their treatment, to get the background and history of their condition, and to get what outcome the patient wants to achieve. Because if the patient is not engaged and motivated, it's going to be tough to actually get a really good outcome. We then start our assessment looking at appropriate non-weight-bearing assessments, weight-bearing assessments that replicate normal weight-bearing movements, and looking at where the plantar pressure analysis fits into the examination, how it relates to the actual function of your patient's foot and gait, and the interaction of joints and muscles with the body weight, so that you know the components that you'll need to address. And this will be different whether it is an acute condition or part of a rehabilitation strategy. We'll also include data from other sources such as video, running on a treadmill, balance assessment, and how you can use these to make the situation more clear. I'll provide the research and theory behind the assessments and explain why they're reliable. We'll look at the challenges most of us have in recording and assessing all the patient information in a time-efficient and effective way that leads us down a logical pathway. This is so important because if the information we gain from our assessment doesn't lead us directly to some form of diagnosis and treatment strategy, then why are we doing the examination in the first place? We then move on to the treatment strategy and the appropriate pathways for the presenting condition for our patient. No doubt we all have our favorite treatment options, but if one of your colleagues on your health team asked, what is the basis of your treatment? What evidence do you have that it's going to make a significant difference? And how are you going to explain how that will be effective? This course will help provide you with those answers. We go through the crucial steps of diagnosing a condition, implementing an appropriate treatment strategy, and seeing how the patient will get better, rather than just relying on the subjective nature of symptoms. A whole session of the webinar will be on the review examination, the associated assessments and pathways to continue our patient's improvement based on objective information. Focusing on evidence-based processes is the only way that I have found getting consistent results that I can be confident about, especially when I'm working with other health practitioners. This webinar course aims at assisting that process more than anything. I think that you'll really find it worthwhile.